Afternoon. I'm Dr. Terry James Gingras, and this is Dr. G's ADHD Chat. This is a Facebook Live show that starts with the premise of trying to make the world safe for ADHD. I say that semi-humorously because I know a lot of times it's not a joke. Okay, I am a clinical psychologist and neuropsychologist in private practice, and a sizable portion of my treatment group has or fears they have ADHD. I'm also the father of a child with ADHD, and I also have relatives who are ADHD. Let's put it that way. Sometimes in ADHD families, when a child is diagnosed and people hear about the heritability, that it is highly heritable, mom and dad look at each other. Is it you? Your brother's a little, or the other one go in the other direction. But it's not really important where it comes from. It's important that you've got it. You got to deal with it. But it is and would be important for you to know enough about your family tree, about your relatives and so on, to know if there are people who have the symptoms, whether or not they were ever diagnosed with it. That's kind of an important thing to know, so you can, basically look at your own behavior and see if that is caused, or some of the situations you find yourself getting into are caused by perhaps an undiagnosed ADHD. I mentioned that I do a lot of evaluations of ADHD, and a lot of times I'll start out doing one of the children because they're getting into trouble in school and so on. And before I'm done, I've done one or both parents and a brother or a sister or two as well. And this is not because I'm such an excellent salesman or anything, but it's, you start seeing behaviors in a family, and they start recognizing what's going on with their child, and then they start thinking, that sounds a lot like me. I really should do something about that. So, today we want to talk about medications. And we particularly want to talk about titrating medications, because that is the big boogity-boo thing that causes problems, and many times folks are not even told that there are issues with that sort of thing. Titrating is just a fancy term for making sure that you have the right dosage of medication. Okay, with medication, and we'll try to stick to ADHD, with medication for ADHD, there are two questions you have, is which type of medication do I use, and then how much of that medication do we need to use? Because having too little on board will kind of make you think, having too low a dosage will make you think that this stuff's not working. It's the wrong stuff. We got to find other stuff. And too much will also not be effective. And there may be a lot of side effects that way. So you've got to really work hard with your doctor to ensure that you get the right dosage for your child at his particular stage in life. Then you've got to recognize that things change over time, so that your dosage when your child was in the 3rd grade and weighed 70 pounds might not be enough for when he's playing middle linebacker on his high school football team and topping out close to 200 pounds. Your doctor should be aware of that and be thinking about it, but it's also on you to remind him or her that there have been some big changes in your child's body type. Basically what we're talking about is metabolic rate. That is, how fast does your body metabolize what you put into it. And it's not always just size that makes the determinant. I've seen, and I probably have mentioned this before, big, offensive linemen kind of looking guys who are on a minimal dosage of their medication. And I've seen little skinny 11-year-olds that are on the max dosage you can get on board. And that's not necessarily mismanagement, that's just what tends to work. Now, the unfortunate thing we have with the whole titrating thing is that, well, first of all, our medical system is kind of overrun. We got family practice docs that are trying to see 25 patients a day. That is not ideal for, in-depth consultation or even much time to think about an individual patient. So you got it's on you to kind of remind them. And there are checklists out there available for you to kind of help you monitor what's going on with your child, and if the things that used to be problematic and then got better with medication suddenly start becoming problematic again, that's a signal that you need to do something about it, okay? And I neglected, I sort of thought about doing this kind of late, but there are checklists out there, and I will research them and see if they've changed any since the last one I used. I use one that's pretty, it's pretty basic, bare bones. It's kind of easy to use, but I will look at that and find it and get it to you probably next time or sometime during the week. But the thing we need to do is take some responsibility and not just leave it on the doctor to remember to ask the question, especially if you're his 20th patient of the day. Divide that out and figure out how many hours it'd take. There are a couple of things about the whole medication thing. Number one is you have to make sure that you got a good initial evaluation, okay? An evaluation for ADHD, you can't call it an evaluation for ADHD if you just got a checklist and had to fill it out. That is insufficient, okay? There is no way that is good enough to put your child on a whole lifetime of medications. Simple? Okay. A good evaluation evaluates the things you have to look at to establish a diagnosis. It also looks at things that you want to rule out, because a lot of things sort of look like ADHD. Things like anxiety, obsessive compulsive behaviors, that kind of stuff can make somebody appear to have difficulties with controlling attention and so on. So your psychologist needs to, I'll go through a little bit about what I do. I have a continuous performance test that I use. Continuous performance test is basically usually a computerized assessment measure, and it will give you some measures of the ability to sustain attention, control attention, some measures of impulsivity, and so on. Okay, then I routinely use a verbal learning task that has distraction built into it. So a lot of times you will do a learning, you present the same information multiple times, and hopefully they start to add more and more information. And then you do a distraction trial, something different, and see if that really blows them out of the water in terms of, messing up their performance on the overlearn thing, okay? You also want to do something that gives you a pretty direct look at frustration. I like to use a visual learning task that has a really complicated design, and you ask them to draw it, and you time them while they draw it. And usually for somebody with ADHD, you will get that the time it took them to do the drawing is normal, in the normal range for whatever their age and education level. But then the quality of the copy is usually in the toilet if they've got ADHD. It's one of these, you gotta be kidding me, I'm not gonna, here, take that and get it away from me. So, evaluation. You want a good, solid evaluation. You can't have if you don't have a good evaluation, you're not sure of what you've got. Okay, I will just tell you that right now. You can't be sure you've got ADHD. So they need to have really a detailed evaluation. You need to know for sure that that's what you've got. Then the medication question becomes, because if what you're thinking is ADHD is really anxiety, I guarantee you stimulants are not going to be matter of fact, you think about it. Take a kid who's anxious already and you put him on a stimulant. He may vibrate apart. So, I joke, but that you don't want to mess with that. If you don't have a good idea that you have the right diagnosis and it was done by somebody who does a lot of that sort of thing, go back and get it done again. Get a real one done, because it's important. And ideally, it gives you some goals for not a lifetime, but at least the immediate 4 or 5 years, so that you know that, for instance, that he could do well in school, he's smart enough, his reading is good enough, so on. If he could just pay attention, man or her, girls are a lot different, just because most of the time with girls with ADHD, it's more the inattentive type. And I know some people, that's good. Well, I'm sorry, but that's just the way the numbers work out, okay? There are some, I know, I've seen their mothers, they come tooling up to my office on their motorcycles and want to talk to me about ADHD, okay, fine, not a problem. But titration, like I said, is you have to work with your doctor to get a proper dosage, okay? Most of the time, most of the people are looking at a stimulant. That's probably the most frequently used medication for ADHD. And, I don't recommend just doing willy-nilly. I think, though, that I see what happens to kids who have ADHD and don't get proper treatment for it. I see what happens to them when they become adults. And it's not pretty, okay? They typically have more troubles with drugs and alcohol. They have troubles with relationships. They have troubles with advanced education. They have troubles with keeping jobs. It's one of those conditions that really has a big effect on your life as an adult. You look normal, but people think you're some kind of a sociopath, or just never grew up, or all kinds of words like that, or descriptors like that. So, it is really important that I recommend researching your fears, and do it with reputable sources of information. Just Googling, a general group or something probably is not going to get you any scientifically verifiable answers to things, okay? You want the real information. So go to the professional organizations in each area of ADHD, whatever other conditions you may be thinking, and get what the research says. Because, yeah, there are some flaws with research, there's no doubt about it, but it's the best way we know to establish what's the truth of situations. And it's your child, and you do not want to have him or her become, I don't know, his victim's probably a little bit strong, but you don't want to delay their treatment for some unproven weeds and seeds kind of solution to ADHD. It's too important, and honestly, you think there's a lot of time, but there's really not. If you don't start getting them on board pretty early in their elementary school career, it's going to be not pretty when they hit high school. And so you want to get this stuff sorted out as early as you can, as effectively as you can. But you also need your role. Okay, say you decide that you're going to put your child on a stimulant medication. You need to be paying attention. Okay, you can't be that parent that's always distracted or always watching ESPN or always got work to do or something. You got to look at your kid, see what he or she is doing, how they're handling things. Are they able to concentrate better? Do they have more control of their emotions? Are they maybe a little better organized? You've got to. You can't just wait until the day before you're going to go back for a doctor's visit to start paying attention to that. You've got to be paying attention to it all along. Okay, so I urge you to work with your doctor to track your child's behavior while he or she is getting started on medication, and understand that you're looking for the just right dosage. You don't want too little, you don't want too much. You want the amount that is going to do the most good for your child. And you can't just expect the doctor to be able to tell that, in a 15-minute medication checkup. Okay, you're going to have to help him or her. And part of the way you do that is you actually take notes. Write stuff down. I don't know about you, but when I go to a doctor's office for myself, my brain just goes totally. I can't remember what symptoms I'm having, if I'm having any. So don't you be that parent that does the same thing. Oh yeah, he's doing okay, I think. Not a big deal. One time he had a headache, but keep track of it. They want to know. Does he have a headache every night? How long does it last? Does it go away before morning? You just want to know. He or she, whoever your doctor is, wants to know that stuff. And they can't know it if you don't tell them that. Because it's unlikely that your son or daughter is going to give them a detailed sort of bit of information about that. So, okay, first off, get a good evaluation. Second of all, understand titration means getting just exactly the right dosage. Not too little, not too much. There are bad results, ineffective results, shall we say, if they don't have enough on board. And there are also some problems if they have too much on board. Okay? I used to hear about, he's like a zombie on that stuff. Well, I do a little more research. I find out that he's on probably twice as much as he should have been on. And that likely explains the zombie stuff. Because, putting your child on a stimulant medication should in no way make him a zombie. Okay? Even if he doesn't have ADHD, it shouldn't make him a zombie. Okay. Like I said, stimulant medications are the ones that are most frequently used. Folks like them because you take them, they're on board 20, 30 minutes, they're doing their thing. They metabolize out at the end of the day like you didn't take them, okay? Versus the other kind of medications which work on neurotransmitters. You need to take those for 2 or 3 weeks before you build up a high enough blood level to know if they're going to work for you. And then you have to take them every day. You can't skip, you can't mess up, or you're going to have to start all over again building up a blood level. Okay, so do start them on medication if they have been properly diagnosed, and then do work with your doctor to get the right dosage, to help your doctor titrate the dosage so you get the optimal benefit out of the medication. And that's the main thing for you to do as far as medication is concerned. Okay, that's it for me today. I am Dr. Terry James Gingras. This is Dr. G's ADHD Chat. We are the show that tries to make the world safe for ADHD, because as you well know, ADHDers think outside the box. And conventional thinkers never change the world, but unconventional thinkers change it all the time. So maybe your child will be the one that's going to make a huge breakthrough in the environment or electrical power, or I don't know. But encourage your child and enjoy your child, because it'll probably be a wild ride. Okay, that's me. I'm Terry James Gingras. I'm available at terrygingrasphd.com. I accept and really like to get comments. I need, I need some information from you on what you think I might spend a little more time covering. And I got something I'm thinking about doing, and I'm not sure exactly the best way to do this. So maybe if some of you would like to comment on that. I am thinking about whether or not to add a couple of more shows on ADHD for ADHD adults. 2 big areas I think of are kind of a coaching show for ADHD entrepreneurs, because ADHDers, I think I've already done a show on them, but ADHDers make really great entrepreneurs. And another one on perhaps ADHD relationships, because that's usually a big problem area, particularly for adults. So I'm not sure whether to just sort of fold that into this show or make each one a separate show of its own. So help me out there, if you would, with some comments. Okay, that's me for this week. We will catch you next time.